all 50 states will be halting use of Johnson & Johnson's coronavirus vaccine. The FDA and the CDC recommended a pause Tuesday after 6 women developed blood clots. They reportedly saw symptoms within a week or two of getting the vaccine. The setback has raised questions about the nation's vaccine supply, but President Biden assured there are still enough doses for, quote, every single solitary American. So far, nearly 23% of the population is fully vaccinated, and more than 122 million people have received at least one dose. Jericka Duncan leads off our coverage from New York City.
Tonight, pressing pause. Americans are being turned away from the Johnson & Johnson vaccine. Some offered Pfizer or Moderna instead after the stunning announcement that 6 women developed a rare blood clot in the brain after getting the vaccine.
This is a recommendation, and it's not a mandate. It's out of an abundance of caution.
Within hours, one by one, every state followed the doctor's orders. But even with millions of doses now on hold,
the J&J vaccine makes up less than 5% of the more than 190 million recorded shots in arms in the United States to date.
The women affected also had low levels of blood platelets. Their symptoms began 6 to 13 days after they got the shot. One woman died, another is in critical condition. And there's a striking similarity. All were of childbearing age. The FDA says they do not see a link between clotting and oral contraceptives.
The women who developed this disorder, this rare disorder, were between the ages of 18 to 48. What does that tell you?
There may be something related to hormones. We just don't understand it enough yet.
Sabra Klein with Johns Hopkins studies the different ways men and women respond to vaccines.
These types of events should be a call that we need to be comparing the responses and the outcomes between men and women.
Health officials say people who have received the J&J vaccine in the last 3 weeks should look out for symptoms like shortness of breath, abdominal pain, severe headaches, and leg pain. It could be a sign of a more serious problem.
One shot and one shot only.
More than 7 million Americans have received the J&J vaccine. About 10 million more doses are circulating throughout the country. Last month, J&J suffered another blow when 15 million vaccine doses were ruined after being contaminated at a Baltimore manufacturing plant.
What are the chances that this vaccine is removed altogether?
Oh, I think that's very, very unlikely. I mean, this is a very safe and effective vaccine. The chances that we'll remove this, I think, is extraordinarily low, and I don't think it would be warranted based on the data we have.
And we're learning that one of those 6 women is from Virginia. She died after suffering a stroke-like syndrome less than 2 weeks after receiving that J&J vaccination. Meanwhile, Pfizer says it plans to ramp up production and can deliver more doses sooner than expected. Elaine?
Jericka Duncan, thank you. For more, let's bring in Dr. Taison Bell. He's a critical care and infectious disease physician and the medical ICU director at the University of Virginia. Dr. Bell, welcome. Thanks very much for being with us. As we've reported, all states are pausing Johnson & Johnson's vaccine. It follows 6 cases of a, quote, rare and severe type of blood clot. What more can you tell us about this complication? How serious is it?
Well, as you noted, it could potentially be fatal. There's one person who has unfortunately died of the complication, but fortunately, it is very rare. 6 cases out of almost 7 million that have been vaccinated, so we're talking around 1 in a million. But what's important, and why I agree with the decision to go ahead and pause, is that we do treat this differently than usual blood clots. For normal blood clots, we usually use heparin products in the hospital. But this could potentially make this specific kind of blood clot worse. And so it's important to get that information out. I also think it's important to pause and make sure that we can collect all the data that we can learn as much as we can about the rare complication. We know that 6 cases in women so far. There could be more, and it could be in different kinds of patients. And then third, ultimately, we need to make sure that speed and equity are also important, but we need to ensure safety as well. The safety reporting system the CDC established worked exactly the way that it was supposed to. And what this does is ultimately ensure that we're making sure that the vaccine is safe, effective, and we can have vaccine confidence because we're making sure that we're following the science and making sure that we're following up on these signals.
Well, doctor, should people who have already gotten the vaccine be concerned?
Well, I would say if you've received the vaccine, just remember that the numbers are on your side. There have been millions of people who have received the Johnson & Johnson vaccine, and you can count on two hands the number of people who have had this rare complication. So there should be some assurance there. But as noted, if you're within 3 weeks getting the vaccination and you have severe headaches, severe shortness of breath, leg swelling, or abdominal pain, that's something to alert your healthcare provider for and to get checked out.
Well, how could this Johnson & Johnson setback impact U.S. vaccination efforts overall?
Well, Johnson & Johnson, we're planning on getting 100 million doses out by the end of May, and this certainly impacts that effort. When you talk to officials at the White House, they do indicate that this doesn't put a big damper on their efforts so far. There have been 180 million doses of Pfizer and Moderna so far, and Johnson & Johnson made up less than 5% of that, and there are enough Pfizer and Moderna vaccine doses to cover 300,000 or 300 million Americans, rather. So, from that standpoint, we do have enough vaccine to make it there, even if the Johnson & Johnson is turned down. I don't think that it'll completely be pulled from authorization, but it might change in specific populations that ultimately may get the vaccine versus others.
Well, the U.S. has been working to overcome vaccine hesitancy. What would you advise people who are on the fence after learning about these rare side effects?
Well, I do think that's important to have transparency and to make sure that people know when there are these rare side effects. But it's important to recognize the risks of not getting vaccinated as well, too. Over 500,000 Americans have died of COVID-19. We know that long COVID and long-term sequelae can be a problem with COVID-19. And by and large, these vaccines, all three of them, Pfizer, Moderna, and Johnson & Johnson, the ones authorized in the U.S., are very protective against death from COVID-19 and hospitalization from COVID-19. And so if you look on one hand, these rare side effects that really are in the 1 in a million or so, versus that benefit of protection from COVID-19, the overall benefit is towards getting vaccinated and protecting yourself.
Well, infections in the U.S. are climbing, and some experts are worried that the alarming outbreak in Michigan could be a warning sign for the rest of the U.S. Can other states avoid a similar surge?
Yes. Well, the situation in Michigan is concerning. Their cases and hospitalizations have gone up around fourfold over the past 2 weeks. And there have been discussions about the way to get out of it. And vaccinations and getting vaccinations to the state has been discussed. But I think the most important measure at this point is to institute a lockdown and to make sure that we stick with public health measures that we know contain the spread of the virus. This can be a harbinger for what could come in other states. And so I think it's a good signal to others to make sure that we keep our diligence up. In the midst of trying to vaccinate as many people as possible, it's important to know that the vaccine is still here, very active. The variants have been a concern, particularly B.1.1.7 in Michigan and other parts of the country. And so we just have to be extra vigilant when it comes to doing what we can to prevent the spread of the virus.
Such a critical message. Dr. Taison Bell, doctor, thank you.
Thank you.